Several years ago, we had a 60-year-old woman who had stage 4 non-small cell metastatic lung cancer. In addition, she had a thyroid disease. She had a history of substance abuse. She was bipolar and depressed. She was in pain because of her metastatic cancer. And all in all, she felt alone and lost. When she came to PACE, interestingly, she had continued to be followed by a large health system that continued to manage her non-curable stage 4 metastatic lung cancer. And not once had anybody had a discussion about what she wanted, about her goals of care. Rather, they continued to do diagnostic tests. They continued to offer her treatments. Even though the treatments were making her sick, they weren't helping her because she was dying. Not once had somebody had that conversation with her. So when she came into our program, the first thing we did is we started talking to her about what is important to you. She had a lot of regrets because she felt like she had made bad choices during her life, and she really felt like she was now suffering because of bad decisions and bad choices that she had made during her life. And so she had this unresolved pain that if she had taken better care of herself, her life wouldn't be like this. She also expressed to us that she did not want to continue to live like this, but nobody had ever given her the option of what she wanted. When she was going to that large health system for her appointments, she caught the bus. No one had ever offered her a cab voucher or even inquired about how do you get to your appointments. And she caught the bus to those appointments. So we started talking about what was really important. She wanted to get some spiritual closure, so we had our chaplain spend time with her to talk about, what do you want to talk about? What does resolution look like to you? We addressed her pain and the multiple medications that she was on. They were actually conflicting each other, so we had our clinical pharmacists review those medications and get rid of most of them. We had our behavioral health person talk to her about her depression and the deep-seated need that she had to be able to talk about the choices that she had made, the bad choices. And we did that with her. She lived in a home where she had minimal of what she needed to really survive and live well, including she didn't have a refrigerator, and it was coming up to Thanksgiving. And so one of the things that we did is we rallied together. We got her a refrigerator and some other furnishings. Because she had had chemotherapy, she had lost all of her hair. And that was a dignity thing. Hey, ladies, that's a dignity thing, right? And so what the nurses did is they got together and they bought her a Tina Turner wig. Ah, man, that made all the difference. What's love got to do with it, got to do with it? So they got her a Tina Turner wig. And those simple things made such a difference in her quality of life. But here was the biggest thing. She finally resolved that, yes, she had made some mistakes. But even with those mistakes, she could be forgiven. That God would forgive her. And she needed to forgive herself. And so we put all of those things in place. And she said, I don't want any more of these treatments. So we enrolled her into our comfort care, which is equivalent to hospice. And just 3 months after being in our program, she died. She had a quality death. She was at where she wanted because she was at home. She knew she was loved and cared for. All of the resources and things that she needed, we put in place. And so we looked at the impact that home and community-based services within the setting of a PACE program could make on the life of an individual. We made her last 3 months probably better than her last 60 years had been, and we gave her a quality death. Do you know that you can have a good death just like you can have a good life? We were able to do that. And I'm reminded of the scripture in Mark where Jesus said, when you do this as unto the least of these, you do it as unto me. So we had a phenomenal opportunity to change an individual, but our ability to have creative funding, our ability to have a team, our ability to focus on exactly what she needed. This is what you call patient-centered. It was what she needed, when she needed it, and we honored it. So that's one of the success stories. We have many success stories. We have medical students that rotate through PACE, and they talk about they can't believe that PACE is able to do the types of things that we do that will impact the lives of these older adults.